This is ECG of 65-year-old woman with shortness of breath and legs edema. She had prior myocardial infarction with successful revascularization. Now her ejection fraction is 32%. Patient obtained full range of optimal medical therapy. I have a question according this case in the end of this video, so keep watching until the end. We will examine ECG by the order in the left. And first thing that we need to check for correct ECG examination is voltage and paper speed. As you see, 10 mm is 1 mV and paper speed is 50 mm per second. The next step is pacemaker of the heart. For evaluation the pacemaker of the heart, let's find the P wave in second standard lead and AVR. If P wave is located before every QRS complex and is positive in second standard lead and negative in AVR, this is sinus rhythm. Little tip for P finding. If P wave is hard to find in extremity leads, check V1. This lead is near to atria, so P wave as atrial depolarization is more clear here. Next step, regularity. For evaluation regularity, let's check the RR intervals. If the RR intervals are equal to each other or difference between them is less than 10%, rhythm is regular. You can estimate this by your eye, but it will be better if you will clear calculate this. The first RR interval is equal 7 large boxes and 2 halves of large box. The sum is 8 large boxes or 0.8 second. Remind that in this paper speed 1 large box is 0.1 second. The second RR interval is equal 7.5 boxes, that is equal 0.75 second. For clear calculation of difference in percent, we divide smaller RR by larger. As a result, second RR is 93% of first one, so difference is 7%, that is less than 10%, which concludes the regular rhythm. The next step is heart rate. For calculation of the heart rate, we need 60 divided by RR interval in seconds. In our example, heart rate is 75 beats per minute. After this, let's check the mean QRS axis. For this we need to find maximal amplitude of R wave in extremity leads. In our example is first standard lead. And also we need to find biphasic or near to biphasic QRS in extremity leads, which is in AVF. After this, we use XXL diagram and find the lead with maximal R wave. This lead will indicate the alpha angle of mean QRS axis. For checking the correct evaluation, the lead with biphasic complex should be at right angle according to the XXL diagram, as in our example. As a result, alpha angle is 0 degree, that indicates the horizontal mean QRS axis. Next step is one-by-one evaluation of all waves and segments. The first is P wave. Duration of P wave is 0.1 second, which is normal. Remind that upper limit is 0.12 second. Normal P wave amplitude should be less than 2.5 mm, as in our example. The next PQ or PR interval, which is equal 2 large boxes and 2 small boxes, or 0.24 second. Upper limit of PR interval is 0.2 second, so we have PR interval prolongation. PR interval represents AV nodal conduction and prolongation of AV nodal conduction, called first degree AV block. Next step is evaluation of QRS complex duration, which is equal 1 large box and 3.5 small boxes, or 170 milliseconds. The normal range of QRS duration is from 60 to 80 milliseconds, so QRS duration is increased. QRS duration represents intraventricular conduction time, which is provided by His bundle branches, so if QRS duration is long, it can be left bundle branch block or right bundle branch block. For distinguish one from another, we need to check QRS, ST and T in left and right leads. Left leads is first standard lead and V5 V6. QRS in all of left leads is similar, we described the first standard lead. QRS here is represented by white R wave with notched peak. There are no Q wave and no S wave. Also in this lead we see descending ST segment depression with up-oriented convexity, which prolongs to negative asymmetric T wave. Now look at the right leads V1, V2. In these leads, QRS has QS or RS form, which is followed by ascending ST segment elevation with down-oriented convexity. Amplitude of R waves is raised from the V1 to V4 when R becomes wide and notched. So longer than normal QRS, wide notch R wave with descending ST segment depression and up-oriented convexity with negative asymmetric T wave in left leads. QS or RS, which is followed by ascending ST segment elevation with down-oriented convexity in right chest leads, indicate left bundle branch block. If the QRS duration more than 120 milliseconds, left bundle branch block is complete. Another important thing is QT interval measurement in case of left bundle branch block, because high QRS duration can overestimate the QT interval. Firstly, measure QT by tangent method. We have another video according to QT interval measurements. QT is equal 3 large boxes and 6 small boxes, or 420 milliseconds. Especially in left bundle branch block, we should calculate modified QT interval, which marks QTM, by formula measured QT minus half of QRS duration. So modified QT is equal 335 milliseconds. Now let's calculate corrected QT interval. Remind that heart rate was 75 beats per minute. For this I use app in my phone, link will be in description. The most accurate formula for corrected QT in case of left bundle branch block is Hodges formula. So corrected QT is equal 361 millisecond, which is in normal range. Also you can use Friderichia formula, but it is less accurate. Buzzard formula is inaccurate in case of left bundle branch block. And now final question for the advanced. What is your next management step? Write your thoughts in comment below. If you like the content, press like, subscribe to our YouTube and Telegram channel, and have a good day.
Here we go.